Hi, welcome to Professional Certifications channel. Let's break down RHIA exam preparation, one topic a day for focused and effective learning. Today's topic is Uniform Hospital Discharge Data Set, UHDDS, in healthcare.
1. What is standardization in healthcare? So, what exactly is standardization in healthcare? Standardization refers to the process of establishing common protocols, guidelines, and best practices across different areas of healthcare to ensure consistency, quality, and safety in patient care. This can include clinical procedures, documentation practices, technology usage, and more. The goal of standardization is to reduce variability in care delivery, minimize errors, and improve overall patient outcomes. By following standardized processes, healthcare providers can ensure that all patients receive the same level of care, regardless of where or by whom it is delivered.
2. Key areas of standardization in healthcare. Standardization in healthcare can be applied across various areas, each playing a critical role in ensuring consistent and high-quality care. Let's explore some of the key areas where standardization is essential. 1. Clinical protocols and guidelines. One of the most important areas of standardization is the development and implementation of clinical protocols and guidelines. These are evidence-based practices that healthcare providers follow to diagnose, treat, and manage specific conditions. For example, there are standardized protocols for managing heart attacks, strokes, and infections. By adhering to these guidelines, healthcare providers can ensure that patients receive the most effective and timely care. 2. Medical documentation. Standardization in medical documentation involves the consistent use of formats, terminologies, and procedures for recording patient information. This includes standardizing electronic health records, EHRs, coding systems like ICD-10, and clinical notes. Consistent documentation practices help ensure accurate communication among healthcare providers, facilitate data sharing, and support continuity of care. 3. Technology and equipment. Standardization also applies to the technology and equipment used in healthcare. This includes ensuring that medical devices, software systems, and IT infrastructure meet standardized specifications and are compatible across different healthcare settings. For example, standardizing the interfaces of EHR systems allows for seamless data exchange between different providers, enhancing the coordination of care. 4. Quality measurement and reporting. Standardization in quality measurement involves using uniform metrics and reporting practices to assess healthcare performance. This includes standardized indicators for patient outcomes, safety, and satisfaction. By using consistent metrics, healthcare organizations can benchmark their performance, identify areas for improvement, and ensure accountability. 5. Training and education. Standardization in training and education ensures that healthcare professionals receive consistent and comprehensive training on clinical protocols, technology, and safety practices. This includes standardized curricula for medical education, certification requirements, and continuing education programs. Standardized training helps ensure that all healthcare providers have the necessary skills and knowledge to deliver high-quality care. 6. Regulatory compliance. Standardization plays a critical role in ensuring compliance with healthcare regulations and accreditation standards. This includes adhering to standardized procedures for data privacy, infection control, and patient safety. Regulatory agencies, such as the Joint Commission, establish standards that healthcare organizations must meet to maintain their accreditation and operate legally.
3. The benefits of standardization in healthcare. Standardization offers numerous benefits for healthcare organizations, providers, and patients alike. Let's explore some of the key advantages of implementing standardized practices in healthcare. 1. Improved patient safety. One of the primary benefits of standardization is the enhancement of patient safety. By reducing variability in clinical practices and ensuring that all providers follow evidence-based guidelines, standardization minimizes the risk of errors, complications, and adverse events. This leads to safer care environments and better patient outcomes. 2. Consistency in care delivery. Standardization ensures that patients receive consistent care, regardless of where they are treated or who is providing the care. This is particularly important in large healthcare systems with multiple locations, where standardization helps ensure that all patients receive the same high level of care. Consistency in care delivery also supports patient trust and satisfaction. 3. Efficiency and cost-effectiveness. Standardized processes help streamline operations, reduce waste, and improve efficiency. By following established protocols and using standardized equipment, healthcare organizations can reduce redundancies, avoid unnecessary tests or procedures, and optimize resource utilization. This not only improves efficiency but also reduces costs, making healthcare more affordable for patients and providers. 4. Enhanced communication and collaboration. Standardization in documentation, technology, and communication practices facilitates better collaboration among healthcare providers. When everyone uses the same language, tools, and procedures, it's easier to share information, coordinate care, and work together to achieve the best outcomes for patients. This is especially important in multidisciplinary teams where clear communication is essential for effective care delivery. 5. Support for quality improvement. Standardization provides a foundation for continuous quality improvement. By using standardized metrics and reporting practices, healthcare organizations can track performance, identify areas for improvement, and implement targeted interventions. Standardization also supports benchmarking and best practice sharing, allowing organizations to learn from each other and drive overall improvements in care quality. 6. Regulatory compliance and accreditation. Adhering to standardized practices helps healthcare organizations comply with regulatory requirements and maintain accreditation. This is crucial for avoiding legal penalties, ensuring reimbursement from payers, and maintaining a positive reputation. Standardization also simplifies the process of meeting regulatory requirements, as it provides clear guidelines for what is expected.
4. Challenges of implementing standardization in healthcare. While standardization offers many benefits, implementing standardized practices in healthcare can be challenging. Let's discuss some of the common challenges and how they can be addressed. 1. Resistance to change. One of the biggest challenges to standardization is resistance from healthcare providers and staff who may be accustomed to their own ways of doing things. This resistance can stem from a fear of losing autonomy, concerns about increased workload, or skepticism about the effectiveness of standardized practices. To overcome this challenge, it's important to involve frontline staff in the development of standards, provide education and training, and communicate the benefits of standardization for both patients and providers. 2. Balancing standardization with individualized care. Standardization must be balanced with the need to provide individualized care that meets the unique needs of each patient. While standardized protocols provide a framework for care, they should not be rigidly applied in every situation. Healthcare providers must use their clinical judgment to adapt standards to the specific circumstances of each patient. Flexibility in patient-centered care should be built into standardized practices to ensure that they enhance, rather than hinder, personalized care. 3. Implementation across diverse settings. Healthcare settings vary widely in terms of size, resources, and patient populations. Implementing standardized practices across diverse settings can be challenging, as what works in one setting may not be feasible in another. To address this, standardization efforts should consider the specific needs and constraints of different healthcare environments. Tailoring standards to fit the context while maintaining core principles can help ensure successful implementation across a variety of settings. 4. Maintaining flexibility for innovation. While standardization promotes consistency, it should not stifle innovation. Healthcare is a rapidly evolving field, and new treatments, technologies, and practices are constantly emerging. Standardization efforts should be flexible enough to incorporate new evidence and allow for continuous improvement. Regularly reviewing and updating standards ensures that they remain relevant and reflect the latest advancements in healthcare. 5. Data integration and interoperability. Standardizing technology and data systems is crucial for seamless information exchange, but it can be challenging due to the complexity and diversity of healthcare IT systems. Achieving interoperability between different systems requires significant investment in technology and collaboration among stakeholders. To overcome this challenge, healthcare organizations should prioritize the adoption of standardized data formats, interfaces, and communication protocols that facilitate interoperability and data sharing. 6. Resource constraints. Implementing standardized practices often requires resources, including time, training, and financial investment. Smaller healthcare organizations or those with limited resources may find it challenging to adopt and sustain standardized practices. To address this, healthcare systems can provide support through shared resources, collaborative networks, and financial incentives. Tailoring standardization efforts to the available resources while maintaining core principles can help make them more accessible to all organizations.
5. Best practices for implementing standardization in healthcare. To maximize the benefits of standardization and overcome potential challenges, healthcare organizations should follow best practices when implementing standardized practices. Let's explore some key strategies for successful standardization. 1. Involve stakeholders in the process. Involving all relevant stakeholders, including clinicians, administrators, IT staff, and patients, in the development and implementation of standardized practices is crucial. Engaging stakeholders ensures that the standards are practical, relevant, and widely accepted. Stakeholder involvement also helps address concerns, build buy-in, and promote a sense of ownership over the standardization process. 2. Focus on evidence-based practices. Standards should be based on the best available evidence and reflect current clinical guidelines and research. This ensures that standardized practices are effective and lead to improved patient outcomes. Regularly reviewing and updating standards based on new evidence helps maintain their relevance and effectiveness. 3. Provide education and training. Comprehensive education and training are essential for successful standardization. Healthcare providers and staff should receive training on the importance of standardization, how to implement standardized practices, and how to adapt them to specific patient needs. Ongoing training and support help ensure that standards are consistently applied and integrated into daily practice. 4. Use technology to support standardization. Leveraging technology, such as electronic health records, EHRs, clinical decision support systems, CDSS, and data analytics, can enhance the implementation of standardized practices. Technology can automate processes, provide real-time guidance, and facilitate data sharing, making it easier to adhere to standards. Investing in interoperable systems that support standardization is key to achieving consistent and high-quality care. 5. Monitor and evaluate outcomes. Continuous monitoring and evaluation are essential to assess the effectiveness of standardized practices. Healthcare organizations should track key performance indicators, KPIs, and patient outcomes to determine whether standards are being met and where improvements are needed. Regular feedback and audits help identify gaps in implementation and provide opportunities for refinement. 6. Promote a culture of continuous improvement. Standardization should be seen as part of a broader commitment to continuous improvement. Healthcare organizations should foster a culture where feedback is encouraged, and where staff are empowered to suggest changes and innovations. By promoting continuous learning and improvement, standardization efforts can evolve to meet changing needs and drive ongoing advancements in care quality.
6. The future of standardization in healthcare. As healthcare continues to evolve, the role of standardization will become even more critical in ensuring consistent, high-quality care. Let's explore some trends that may shape the future of standardization in healthcare. 1. Expansion of value-based care models. As healthcare shifts towards value-based care models, where reimbursement is tied to patient outcomes, standardization will play a key role in ensuring that care is delivered efficiently and effectively. Standardized practices will help healthcare providers meet quality benchmarks, reduce variability in care, and achieve better patient outcomes in a value-based care environment. 2. Integration of artificial intelligence, AI, and machine learning. AI and machine learning are poised to revolutionize healthcare by providing new insights and automating complex tasks. Standardization will be essential for integrating these technologies into clinical practice, ensuring that AI-driven tools are used consistently and safely. As AI becomes more prevalent, standardized protocols for AI usage will help maximize its benefits while minimizing risks. 3. Global standardization efforts. As healthcare becomes more interconnected globally, there will be increasing efforts to standardize practices across different countries and regions. International organizations, such as the World Health Organization, WHO, will play a key role in promoting global standards for clinical care, public health, and healthcare technology. Global standardization will help ensure that patients receive consistent care, regardless of where they are located. 4. Personalized medicine and genomics. The rise of personalized medicine, driven by advances in genomics and biotechnology, will require a new approach to standardization. While personalized medicine focuses on tailoring treatments to individual patients, standardization will be needed to ensure that these personalized treatments are based on consistent and reliable protocols. Balancing standardization with personalization will be a key challenge for the future of healthcare. 5. Patient-centered care models. As healthcare increasingly focuses on patient-centered care, standardization will need to incorporate patient preferences, values, and experiences. This means developing standards that are flexible and adaptable to individual patient needs while maintaining core principles of quality and safety. Involving patients in the standardization process will be crucial for creating practices that are truly patient-centered. 6. Advanced data analytics and interoperability. The future of healthcare will be data-driven, with advanced analytics playing a central role in improving care delivery. Standardization of data formats, metrics, and reporting practices will be essential for harnessing the power of big data and ensuring interoperability across healthcare systems. Standardized data will enable more accurate benchmarking, predictive modeling, and decision-making.
Conclusion. In conclusion, standardization in healthcare is a powerful tool for ensuring consistency, quality, and safety in patient care. By understanding the key areas of standardization, the benefits it offers, and the challenges of implementation, healthcare organizations can create standardized practices that enhance care delivery and improve patient outcomes.